What are symptoms of heart attack? Have you ever thought about what you would do if someone close to you had a heart attack? Many people don't notice the small signs because they think it's nothing serious, but moving quickly could save a life. We'll go over the most important signs of a heart attack in this video, including some you might not expect, and tell you what to do if you notice them. An exceedingly severe condition known as a heart attack results from insufficient blood flow to certain parts of the heart muscle. Although there are numerous possible causes for this reduction in blood flow, a blockage in one or more of your heart's arteries is typically the reason. The afflicted cardiac muscle will start to perish without blood supply. If your blood flow returns slowly after a heart attack, you may die or suffer irreversible cardiac damage. A heart attack is an emergency that could be fatal. In the event that you believe you or someone you are with is experiencing a heart attack, dial 911 or the number for your local emergency services. While treating a heart attack, time is of the essence. Even a few minutes delay can cause death or irreversible heart damage. What precisely takes place in a heart attack? A heart attack results in severe blood flow reduction or cessation to a specific area of the heart, injuring or even killing the affected heart muscle. Your heart's ability to pump blood can be compromised if a section of it is dying from a shortage of blood supply. If something isn't done right away, this could be fatal because it could decrease or stop the blood supply to the rest of your body. How often do heart attacks occur? In the United States, over 800,000 people suffer from heart attacks annually. Coronary artery disease, the leading cause of death in the US, is the cause of the majority of heart attacks. How does one feel during a heart attack? A heart attack frequently causes chest pain for many victims. It may feel heavy or constricting, uncomfortable, or excruciatingly painful. It may begin in your chest and move or radiate to other parts of your body, such as your back, shoulders, neck, chin, left arm, or both arms, and down toward your waist. Many times, people mistakenly believe they have heartburn or indigestion when they are actually having a heart attack. Some people only feel queasy, sweat, or have shortness of breath. What signs indicate a heart attack? Numerous symptoms can accompany a heart attack, some of which are more typical than others. Heart attack symptoms that people describe most often include chest pain, angina, shortness of breath or troubled breathing, trouble sleeping, insomnia, nausea or stomach discomfort, palpitations in the heart, a sense of impending doom or anxiety, feeling faint, woozy, or lightheaded. Individuals classified as male at birth, AMAB, are expected to experience distinct symptoms of a heart attack than those assigned as female at birth, AFAB. Individuals who identify as AFAB are less likely to experience indigestion like chest pain or discomfort. Breathlessness, exhaustion, and insomnia that began before to the heart attack are more common in them. Along with pain in the back, shoulders, neck, arms, or belly, they also experience nausea and vomiting. What causes a heart attack? Most heart attacks happen because of a blockage in one of the blood vessels that supply your heart. Most often, this occurs because of plaque, a sticky substance that can build up on the insides of your arteries, similar to how pouring grease down your kitchen sink can clog your home plumbing. That buildup is called atherosclerosis. When there's a large amount of this atherosclerotic buildup in the blood vessels to your heart, this is called coronary artery disease. Sometimes plaque deposits inside the coronary arteries can break open a rupture, and a blood clot can get stuck where the rupture happened. If the clot blocks the artery, this can deprive the heart muscle of blood and cause a heart attack. Heart attacks are possible without ruptured plaque, but this is rare and only accounts for about 5% of all heart attacks. This kind of heart attack can occur for the following reasons: rare medical conditions like any disease that causes unusual narrowing of blood vessels, trauma that causes tears or ruptures in your coronary arteries, obstruction that came from somewhere else in your body like a blood clot or air bubble embolism that ends up in a coronary artery, eating disorders. Over time, these can damage your heart and ultimately result in a heart attack. Anomalous coronary arteries, a heart issue you're born with where the coronary arteries are in abnormal positions. Compression of these causes a heart attack. Other conditions that can cause your heart not to receive as much blood as it should for a prolonged period of time, such as when blood pressure is too low, oxygen is too low, or your heart rate is too fast. What are the risk factors for a heart attack? Several key factors affect your risk of having a heart attack. Unfortunately, some of these heart attack risk factors aren't things you can modify. Age and sex. Your risk of heart attack increases as you get older. Your sex influences when your risk of a heart attack starts to increase. For people assigned male at birth, AMAB, the risk of heart attack increases at age 45. For people assigned female at birth, AFAB, the risk of heart attack increases at age 50 or after menopause. Family history of heart disease. If you have a parent or sibling with a history of heart disease or heart attack, especially at a younger age, your risk is even greater because your genetics are similar to theirs. Your risk increases if a first-degree relative, biological sibling, or parent received a heart disease diagnosis at age 55 or younger if they're AMAB, or at age 65 or younger if they're AFAB. Lifestyle. Lifestyle choices you make that aren't good for your heart can increase your risk of having a heart attack. This includes things like smoking, eating high-fat foods, lack of physical activity, drinking too much alcohol, and drug use. Some health conditions put stress on your heart and increase your risk for heart attack. This includes diabetes, obesity, high blood pressure, high cholesterol, eating disorders, or a history of preeclampsia. What are the complications of a heart attack? Complications associated with heart attacks include arrhythmias, abnormal heart rhythms, heart failure, heart valve problems, stroke, sudden cardiac arrest, depression, and anxiety, cardiogenic shock, mechanical complications of a heart attack such as a ventricular septal defect or free wall rupture. These are more likely to happen with delayed treatment of a heart attack. How do I know if I had a heart attack? Healthcare providers usually diagnose heart attacks in an emergency room setting. If you have heart attack symptoms, you should undergo a physical examination. A provider will check your pulse, blood oxygen levels, and blood pressure and listen to your heart and lung sounds. They'll also ask you about the symptoms you experienced. They might ask someone who was with you to describe what happened. What tests will be done to diagnose a heart attack? A healthcare provider will diagnose a heart attack using the following. Blood tests. One of the most reliable ways to diagnose a heart attack is to check for cardiac troponin in your blood. During a heart attack, the damage to heart muscle cells always causes this chemical marker to appear in your bloodstream. Electrocardiogram, EKG, or ECG. This is one of the first tests you get when you come to an ER with heart attack symptoms. Your heart's electrical signals can help tell if an injury is occurring as well as if there are any rhythm abnormalities. Echocardiogram, using ultrasound, high-frequency sound waves. An echocardiogram generates a picture of the inside and outside of your heart. It can show how well your heart is squeezing and how well the valves are working. Coronary angiogram or heart catheterization. This is a procedure that uses X-rays and contrast dye to show the blood vessels to your heart and can help determine if there are any blockages. Heart computed tomography (CT) scan. This creates a highly detailed scan of your heart and its blood vessels to show if there's any significant narrowing or hardening of the major coronary arteries. Heart MRI, magnetic resonance imaging. This test uses a powerful magnetic field and computer processing to create an image of your heart. It can show problems with the blood flow in the arteries to your heart. Exercise stress test. This test can use an ECG, echocardiogram, or nuclear scans while you're physically active to help show if your heart is receiving enough blood flow. Nuclear heart scans. These scans use a radioactive dye a provider injects into your blood and computer-enhanced methods like computed tomography, CT, to find areas of your heart that aren't receiving as much blood or are injured. These scans can be single photon emission computed tomography, SPECT, scans or positron emission tomography, PT scans. How is a heart attack treated? Treating a heart attack means restoring blood flow to the affected heart muscle as soon as possible. This can happen in a variety of ways, ranging from medication to surgery. Treatment will likely include several of the following methods. Supplementary oxygen. People having trouble breathing or with low blood oxygen levels often receive supplementary oxygen along with other heart attack treatments. You can breathe the oxygen either through a tube that sits just below your nose or a mask that fits over your nose and mouth. This increases the amount of oxygen circulating in your blood and reduces the strain on your heart. Medications. These may include anti-clotting medications. This includes aspirin and other blood-thinning medicines. Nitroglycerin. This drug improves chest pain and causes blood vessels to expand so blood may travel through more easily. Thrombolytic, clot-busting medications. Providers use these only within the first 12 hours after a heart attack. Anti-arrhythmia medications. Heart attacks can often induce faults in your heart's normal beating rhythm called arrhythmias, which can be life-threatening. Anti-arrhythmia medications can stop or prevent these malfunctions. Pain medications. The most common pain medication people receive during heart attack care is morphine. This can assist reduce chest pain. Beta blockers. These medications assist slow down your heart rate so your heart can recover from the injury of a heart attack. Antihypertensives. These medications decrease your blood pressure and can help your heart heal from the injury of a heart attack. Statins. These drugs make the plaque in your heart's blood vessels less prone to burst by stabilizing it. They also lessen the risk of another heart attack and cholesterol. If this information could help you or a loved one, make sure to subscribe and turn on notifications so you can stay informed with more life-saving tips in our upcoming videos.